First of all, I would like to really appreciate the effort of KMPDC coming to Narok through our invitation. This is very handy, actually, I can say that. Previously, I think 3 weeks ago, myself, I was summoned by the county assembly to answer or to shed light to a case of a maternal death we had in a private hospital here in Narok called Shepherd. And I would like to really put it clear that it is the mandate of KMPDC to license and also regulate both public and private health facilities. So KMPDC came in very handy. Actually, we are very appreciative because they have even set a satellite office here in Narok County. So we'll not be rushing to Narok to seek services for KMPDC just within our county. And I want to really appreciate because this is a service that will help our residents in Narok County. We want to actually share, the report will be shared publicly. And what we've heard from KMPDC is most of the people who are running or the owners of those facilities escaped when they heard that KMPDC is doing inspections. And we will put the names of the facilities that ran away into the public. And every other time that they open, will be notified. And we'll even take the initiative as county government through our director and even the staff who is stationed here, and even make follow-up with the DCI so that the people are arrested to comply. What we want to actually ask the public is, why we do inspections is to ensure that somebody who is treating you or the facility that is offering you service is licensed and is actually offers you quality services. So we want to appreciate the medical, the Kenya Medical Practitioners and Dentist Council, actually on even licensure of the staff who are offering services in healthcare. This is something that we've always put it very clear. Any other person who is offering an active service in any health facility should be licensed. And actually, from all cadres, being a medical officer, a clinical officer, a nurse, a public health officer, should have a practicing license. So that is what we are telling the public. You should be treated by somebody who is actually licensed and certified. Otherwise, we want to really appreciate, as the county government of Narok, through the stewardship of our able governor, His Excellency Patrick Ntutu, for public health facilities. We've taken the initiative of actually stocking them with medical supplies. This is evidence or your witnesses. We are even flagging off today some medical supplies to our rural facilities. And we can actually say that improvement of services in our public facilities has even reduced the number of private chemists or pharmacies in the market.
I'm here to give you a report on the inspection report, an inspection exercise that has taken place from 6 November on Monday 2023 to date 10th November 2023. And this inspection exercise has been carried out in conjunction with the Narok County government and the Directorate of Criminal Investigation. And we are targeting to inspect all the registered 263 health facilities in the county. So we want to thank the county leadership through the CEC and the Director of Medical Services here, CEC, able CEC, for enabling us and supporting us to be able to achieve this exercise. So during the week, we are able to visit and inspect a total of 255 health facilities in the county, out of which 75 facilities have been closed, 6 have been partially closed. We have made 6 arrests, and they are being processed through the judicial system. And we want to thank the county again for all this support. So this inspection is geared towards ensuring compliance and is an assessment to ensure that the personnel who are working there, the infrastructure, physical infrastructure, all these activities, together with the operation of the health facilities, comply to the set standards that have been put into place by KMPDC. So going forward, we want to assure the country that we are moving across the country to be able to ensure that we have inspected all these facilities for compliance purposes. So be ready that we will be there. So we want to also reiterate that universal health coverage provides that the provision of quality health care should be of the maximum standard. It should be patient-centered, should be evidence-based. Therefore, quality assurance monitoring is very essential in order for us to be able to ensure that the services that Kenyan people are getting is of the highest quality. Therefore, I'm urging all heads of institutions, directors and owners to ensure that your facility is registered, licensed by KMPDC. And we also engage only those professionals who have been registered, who have been licensed to offer those services according to their scope of practice. Therefore, we are urging also the public to utilize the various forms that we have of ensuring that we find out whether a facility or a doctor, in terms of medical doctor, in terms of dentist, in terms of community oral officer, in terms of a medical camp, in terms of a health facilities, is registered, is licensed by KMPDC through a very interactive website, www.kmpdc.go.ke. We have also a code 20547 where they can be able to query and find out whether this doctor is registered using their names, using their registration number, whether that facility is registered, whether that community health professional is registered, whether that medical camp that you are attending is registered and licensed by KMPDC. So I urge the public, please be vigilant. Don't just walk into a facility, get services to people that you do not know, you don't understand. These are free services that you're able to utilize for you to be able to get the quality of services that you need across the country. So I urge the public, please ensure that you use these services which are there in our website, which we have communicated to the media, and we are continually educating the people of Kenya to be able to ensure that the services they get is of the highest quality. And of course, together with the other county governments, we have been able so far in the last 11 months to inspect a total of over 3,900 facilities across the country. And we have been able to close 609 facilities across the country. And we are telling the other counties, the other places we have not visited, we are there. We are working with the National Police Service. We are working with the county government to be able to ensure that we bring sanity in this health sector, the way the president aspires to achieve. And of course, together with the county government, which is able to assist us to be able to achieve that particular vision. So I urge you, we are not so much worried because the people who are in charge have done quite a bit of work. We are not so much worried. However, there are challenges which we need to tackle and be able to achieve the 100% that we are looking forward to.